Is Carrie Savage, and I'm the Director of Development and Alumni Relations. And I'm also joined here today by Alicia Pisno. She's our Associate Director of University Relations here at Castleton, and she's going to be running things behind the scenes for today, letting participants join from the waiting room and running the mute button and watching the audience for questions from our guests. I want to say that I want to say an incredible special thank you to our panel guests. Each of the alumni featured here today have established successful careers in healthcare since graduating Castleton, and we are honored to have them join us. A little housekeeping before we start. I will give each of our alumni a quick introduction and then ask each one individually to discuss their education and backgrounds in healthcare before we start moving to the question and answer session. We are going to ask everyone but our panelists to stay muted during this time. And there will be an opportunity for us audience members to ask questions. And we encourage you to ask questions of our panelists. When you do, use the chat function to submit your questions and we'll answer them from there. And this program is also going to be recorded and available for a later date. Okay, let's get started. Our panelists today include Adrienne Williams. She is a 2000 nursing graduate with a background in neurosurgery, neuro-oncology, and a nurse practitioner at Dartmouth-Hitchcock. And I have also Nicole Moran. She is a 2004 nursing grad. She is the Chief Clinical Operations Officer at VNA and Hospice of the Southwest region. And Carrie Detweiler, a 2012 graduate in athletic training, and she is a public health nutritionist with the state of Vermont. All right, Adrienne, let's start with you. Could you please introduce yourself and tell us about your educational background in healthcare field?
Sure. So thank you again for having me. I'm really very happy to be here. So my background actually kind of starts, I think, when I was a child. I used to hijack my neighbor's dog and bring it to the local nursing home and visit the residents, and I think that's probably when it started for me. As a teenager, I had various roles, at the local hospital and nursing home and dietary and housekeeping. I even think I did a little stint in laundry. As a teenager, I took a vocational program in healthcare, and that's actually where I think it really focused my attention on nursing. I became an Alumnae for a few years, and during that time, I became a mother. Excuse me. And that's when I made the decision that it was time to go back to school. I wanted to be more for my daughter and be a really good role model for her. Side note, she's actually a Castleton graduate herself. She is a charge nurse up in Porter. So after making that decision, I matriculated into Castleton's ADN program. So at the time, I don't think it existed much after I graduated, but you could graduate with an associate's. I went to Rutland Regional for about a year. I did a year in med-surg, which was a fantastic experience. I learned a lot about general nursing, time prioritization. It was fantastic there. I then moved to the Dartmouth area. I started in the neuro unit, and over the next couple of years, progressed into units and positions with higher acuity. So I went to the step-down unit, which was the neurospecial care unit, and then progressed into the ICU. After a few years in the ICU, I was recruited into a position called an organ donation coordinator. So I spent the next 7 years working for a company called New England Organ Bank, where I would, unfortunately, when someone was identified as being a potential organ donor, would respond to that hospital. And our service area was all of New England. So from Maine to Rhode Island, as far west as Connecticut. And we actually did organ donation down in Bermuda, because for some reason they contract their healthcare with Leahy Clinic. But that role in itself was exceptionally transitional for me, transformational. It was an autonomous role. I did a tremendous amount of work. I was optimizing the donor. I was coordinating where the organs would go. I had to practice at a higher level than a nurse, which was legally allowed because of the situation. And that job made me decide I wanted to go on with my career in education. So I went back to the bedside, matriculated into a program at George Washington, obtained my BSN, and then started a program for my MSN. Once I graduated with my master's, I started my career as an APRN at a local hospital outside of Dartmouth. I didn't want to transition from being a bedside nurse to an APRN with my peers. I wanted to do it away from them, so it wasn't awkward for me. Once I did that, I did about a year in hospital medicine. I then applied to come back to Dartmouth proper. I was offered a position in neurosurgery because of my past experience in neuro. And then I actually kind of worked two jobs. I worked in neurosurgery and I worked in trauma. I did that for about 3 years. And then I was asked to come back to neurosurgery full-time for a role that they created, which is my current role. And what that is, and it's kind of a novel role. I think I'm the only nurse practitioner at Dartmouth that does this. I connect two service lines. So I'm a surgical service line and I'm a medical service line. And the model, which I think is a perfect model for specialty care, is I'm with the patient from onset. So whether they come into our department through the emergency room or they come in through clinic being seen as on a consult, I'm with them through their perioperative phase. So I see them before surgery, after surgery. I then see them in clinic multiple times. And then once the surgical aspect of their time with me is done, I transition with them into medical oncology. And I see them through their treatment, their radiation, their chemotherapy. I'm dealing with a lot of the symptoms that they may be experiencing from the medications or their disease process. My role also includes, I develop support groups specifically for glioblastomas. I'm involved in research. And then 1 day a week, I am actually in our surgical center and I perform bone marrow biopsies. So I think that's it in a nutshell. Did I make it under 5 minutes?
Thank you. That was fascinating. Thank you, Adrienne. Nicole, please introduce yourself and tell us about your education and background in the healthcare field.
Thank you, Carrie, and good evening, everybody. So I am Nicole Moran, and as you heard, I'm the Chief Clinical Operations Officer for the VNA and Hospice of the Southwest region, which is a mouthful. I did not have the desire to go into healthcare like Adrienne did at a young age. I actually wanted to be a marine biologist. It's so far from healthcare. And then decided I wanted to be a teacher and I wanted to teach high school science. And so I went to Castleton and enrolled in the natural science bachelor degree program and got about 3 years in and realized I definitely did not want to be a teacher. I did some shadowing experiences and realized not for me. But in my experience in those years, I took a lot of classes with nursing students and I took microbiology and A&P, and I was really, really excited about the stuff that I was learning in those courses. So I was like, you know what, I'm going to try nursing. Didn't really know what direction I wanted to do. So I got into it and immediately felt like this is what I was supposed to do. I remember back in high school and thinking about like going to parties and stuff. And I was always the one that would take care of my friends who maybe weren't making really good decisions. I tended to be the one that was the sober one and drove everyone home. But so I kind of think back to that, like maybe I was supposed to be a caregiver for a long time. So I ended up graduating Castleton in 2004 with my bachelor's degree in natural science and my associate's degree in nursing, and took a new grad position at our RMC in Rutland and on the cardiac care unit, and was really excited about learning how to be a nurse and really learning the skills that they can't teach you in nursing school. I mean, there's so much you learn in that 2 or 4 year period, but until you're actually out on the floor and interacting with the patients and using your critical thinking skills, you don't really know what it's like to be a nurse. And about 2 years into my experience there, I lost my grandmother, and she was a really, really big part of my life. And I watched her struggle through her dying process. And I thought to myself, wow, this could be so much better. This could be so much more humane and dignified. And at that point in time, I transitioned to hospice care and worked at the VNA in 2006 and 7, providing hospice care at home for people. And I really, really fell in love with it. And I felt like that was probably the most rewarding time in my life as a nurse. I felt like I made the biggest difference in people's lives, even though they were approaching death. And I did choose to leave, however, because the schedule wasn't really conducive to family life. Raising a family and being on call was not something that I could really do. So I went back to the hospital, and a mentor of mine, who many of you may know, Jill Markowski, said, I really think you have some leadership deep down within you, and I think that you should step up and do this interim clinical manager role and see how you like it. And I was like, no way. I'm not a leader. I want to take care of people. She's like, no, she pushed me, and I did it. And I was like, wow, okay, this is a whole different aspect of nursing and healthcare that I fell in love with, helping other people to develop and become amazing nurses. And so I did that and took the position as a full-time about 6 months later. And 4 years after that, I decided, okay, I definitely want to be in leadership. I want to be an admin. And my experience, I had worked for a couple different types of leaders, and some that were really incredible and inspiring and transformative and transparent, and then others that were the complete opposite of that. And it made me realize who I wanted to be as a leader. And I always said to myself, and I stand by this today, that when I got to a level that I felt I needed to be at, I would never forget what it was like to be at the bedside, to be the ones that are doing the care and providing that care. And I truly believe that the best nursing leaders, the best healthcare leaders, don't ever forget that. So I chose to go back to school and got matriculated into Sacred Heart University in a master's in nursing administration, and graduated from that in 2014. And that's when I went to Dartmouth and actually worked with Adrian for about a year, and in the ICU, medical ICU over there. And then felt this really strong pull to go back to hospice and palliative care. And that's when the position opened at the VNA, and I transitioned over to the director of hospice and palliative care. And when I walked back into that building, everyone that was there prior, when I was there, 10 years before, was like, oh, we're hoping it was you. Welcome back. It was like I was home. It was meant to be there. And just being able to give back and provide that support to the staff who are really doing that really tough end of life care. It's really, really challenging. And then in 2020, mid pandemic, I got the promotion to Chief Clinical Operations Officer and oversee all of our clinical programs at the VNA. So hospice, palliative care, home health, all of our maternal child health programs, our community health. It's a lot of oversight, and it's wonderful because everything links together, and our real focus is keeping people out of the hospital and taking care of people where they're the most comfortable. And I love it, and it's something that I'm really, really passionate about and could talk all day. So I'm going to stop now.
Nicole, that was wonderful. Carrie, can you introduce yourself, please, and tell us about your education and your background in healthcare field?
Yes, I'd love to. And thank you for inviting me to be here. I'm so honored to be a part of tonight's event. Well, my family had owned a small family business that was involved in community care, not healthcare, but serving the community at a very vulnerable time. So I think as part of my youth, being around that caregiving environment facilitated just some core values for caring for others and sharing, gifts and skills that you have and that you've learned with others to support them in various capacities. But as far as my direction into healthcare specifically, probably didn't really start until I was in high school and was a high school athlete, and had some orthopedic injuries and was going to the orthopedist and orthopedic surgeon and physical therapists and getting x-rays and MRIs and all of these things to figure out what was going on. And I ended up doing physical therapy with an athletic trainer at a PT clinic associated with the local hospital. And so that just seemed so fascinating. And that's where I sort of fell in love with sports medicine and was like, oh, I could do that. It blends, my interest in caring for people and the human body and all the cool things it does regarding sports and movement, it really meshes them together. So I learned of Castleton and the athletic training program, and I did a accepted students day at Castleton as a high school senior, and with someone in the athletic training department, and the head athletic trainer at the time was teaching a class, and he was like, handed me the ACE wraps and the gauze and was like, here. I was like, I'm supposed to actually do something? I thought I was just sort of here to like sit and learn and watch what college is like. And he's like, no, if you're here and in my class, you're going to do this. So I had a little bit of like hands-on tutorial that day. And I ended up choosing Castleton, obviously, and then enrolling in the athletic training program for my sophomore year is technically when that program begins. And I did completed that program, but partway through, similar to Nicole, I realized that the athletic training, the traditional setting for an athletic trainer is often collegiate athletics. And I also met my husband at Castleton, and just sort of opened my eyes to the idea that the traditional setting for an athletic trainer wouldn't necessarily facilitate some of the other life goals that I have based on some of those core values. And so I did a little bit of soul searching and explored some of my interests and talked to the athletic trainers that were at Castleton at the time, and my professors, and some of whom are still at Castleton, and decided to pursue nutrition and shift my focus academically. So I finished the athletic training program and graduated from Castleton in 2012. And the following fall, I enrolled at Sage Graduate School to get a post-baccalaureate certificate, which is a program that no longer exists. And that would sort of tee me up to be able to apply for dietetic internships, which is a required 1,200 hour practicum experience in hands-on in dietetics. So I graduated from Sage in 2015 and matriculated into the Oakwood University Distance Dietetic Program. And for those who may be unfamiliar with dietetic internships, there are in-person internships where you live in the same city or town as your college or university, and you have a lovely dietetic internship coordinator who says, you're going to go here on this day and there on this day. And with distance internships, you are that person. So I primarily lived in Vermont while I coordinated all of my own supervised practice experiences with registered dietitians and nutrition professionals, primarily in Vermont. And then I was fortunate enough to have a personal contact with a dietitian at Maine Medical Center in Portland, Maine. So I moved to Maine for about 4.5 months and did the majority of my clinical internship in the Maine Medical Center health network. All while my home base still being Vermont. So I finished that program and graduated from them in 2017 and took my board certifications to become a registered dietitian. And a little bit after that, I, through again some community connections, secured a position at the Edge Sports and Fitness, which those familiar with Chittenden County may know that it's a multi-location sports and fitness organization that also has a few other disciplines, including physical therapy and a preschool, a registered or certified preschool. And in 2015, they opened up a preventative care branch. So I worked with I worked as a registered dietitian on that team, along with some personal trainers, health coaches, and exercise physiologists, primarily doing outpatient kind of clinical nutrition counseling for chronic disease management, weight management, some acute health concerns for individuals, certainly not the acuity of which they would be seeing either of our other two panelists, but like subacute pancreatitis and things of that nature, where individuals had been discharged from the hospital, but still need or were free to go from their primary care, but they felt as though they still needed a little bit more support in regards to how to nourish their bodies efficiently and in ways that their body would likely respond well to decrease inflammation and things of that nature. And that was a really fun position. It was my first role as a dietitian, and I did a lot of learning and growing as far as the practitioner and provider that I want to be in that role. I can say without a shadow of a doubt, the provider I was when I started that role and when I transitioned out of it are different, quite different. And then not too long ago, in December of this past year, I was fortunate enough to sign on with the state of Vermont as a public health nutritionist, working in an office of local health with the WIC program. And many people may be familiar with the WIC program. It primarily serves pre- and postnatal women as early on in their pregnancy as they know of, through 1 year postpartum if they are breastfeeding, and 6 months postpartum if they are not breastfeeding, infants and children up to age 5. And this role is a unique blend of public health and increasing access to health resources, and being a healthcare provider and collecting anthropometrics and doing nutrition focused physical exams when we're able to meet in person and not in a pandemic. And anthropometrics, blood screening, and connecting them with other health resources, whether it's a specialist or dental care if they don't have a family dental provider, and then other community resources as well, like some of the programs that Nicole runs through VNA. Strong Families Vermont is one that we connect with frequently. Childcare, housing, other medical specialists. And that's where I am now. And I'm really loving the role and the ability to provide care and support and resources to our most vulnerable populations in Vermont.
Thank you, Carrie. That was fascinating. Adrian, what does a normal day on the job look like for you?
For me, it kind of depends on the day. So the first few days of the week, I am seeing patients, in the hospital. So I round on my patients that have just had surgery or are, having some sort of medical issue. and then I'm in clinic. And then the latter half of the week, I'm in the medical oncology part of clinic. A lot of that is primarily just seeing patients, a lot of counseling sessions, chemotherapy teaching, and then again, 1 day a week, I'm in the surgery center performing the bone marrow biopsies. So.
A lot of different areas to cover.
Keeps it interesting.
Yeah. Nicole, how about you? What does an ordinary day look like for you?
An ordinary day for me, a lot of meetings, to be honest, but a lot of planning and strategizing on how our programs meet the needs of our community. And within that, how do we support and develop the staff that we have to provide the services that they are to the community. A lot of community collaboration, specifically in Rutland, also Bennington County as well. We cover from Rutland all the way down to Bennington County, and a lot of collaborative efforts to really ensure that the health and well-being of our community. So that's pretty much a typical day. Also, putting out fires, as issues come up, and being, the clinical resource when the nurse in the field has a question about a tracheostomy or etc. So,
thank you. And Carrie, what is a normal day for you like with the state of Vermont?
Yeah, so our office, I'm at the Barrie Office of Local Health specifically, and our office has WIC clinic typically every other day on like a rotating weekly schedule. So some weeks it's 3 days a week, and some days it's 2, depending on the calendar. And a day of clinic, currently we have federal waivers due to COVID, where appointments are not required to be in person, nor are we required to collect anthropometric measurements, because families are not coming into the clinic space. And all appointments are conducted by phone, unless there's a specific circumstance where a family would like to be seen in person, or in our region, we also have recently the community has taken in a few Afghan refugee families. And so for those appointments specifically, it tends to be a little bit easier to invite them into the clinic with COVID precautions, so that there can be an in-person interpreter to help facilitate the appointment rather than doing it by phone. But most appointments are done by phone. So a clinic day would involve calling the family, doing the nutrition interview, ensuring that they're still eligible to receive their WIC benefits through various criteria. The nutrition interview, as I mentioned, and issuing their food benefits onto their EBT card, as well as the documentation for that, as any healthcare provider practitioner is well aware of, and any referrals or community resources or consent forms, sharing, because we're in a virtual digital space and not meeting face-to-face, then following up with any education handouts or materials that were discussed or requested. Non-clinic days tend to have a bit more meetings, any cleanup or follow-up from the day prior, and also some time for some projects to really evaluate systems. And now that we're getting back to more in-person services and like kind of day-to-day life, our pre-COVID normal-ish, a lot of meetings and appointments to plan and coordinate what that's going to look like, and how can we continue to meet client needs, and do that in a really meaningful and efficient and tangible way. A normal day could also be a vaccine clinic. So as being a state employee and in the Vermont Department of Health during the pandemic, that also means many of the staff has been reallocated to COVID response activities, which I was not brought onto the team in a time where They were doing a lot of testing, but many of my colleagues were doing contact tracing or pop-up testing sites, and I participated and helped to facilitate a few pediatric vaccine clinics as well. So usually we have, a bit of notice as for those, but that could be a normal day too.
Yeah, it's amazing how versatile you all have to be, pivoting at the last minute within your jobs and your roles. Women traditionally faced many challenges entering the workforce. What are some of the challenges, Adrienne, that you've seen women face in the healthcare industry?
Let's see. I actually would say I've seen an evolution over the last 22 years. I think back to the stories my grandmother told me. She was also a nurse. She was a diploma nurse in Mount Sinai. And she would tell me stories about how the nurses in their very starched white outfits and caps used to have to stand against the wall with their back to the walls while the physicians passed them by. Of course, it wasn't quite that bad when I entered, but I certainly entered in the age of nursing being there young. And you would think healthcare, we would be much more supportive of each other, especially women holding each other, up. We would be pretty vicious. So I think that all by itself is a challenge. Once I was in nursing, I recall feeling that the male nurses tended to be taken more seriously. I never fully understood why. Our education was the same, our experiences were the same, but I remember that being a sore spot for quite a while. I have seen that improve tremendously. But now I think I just read a paper the other day that in 2020, I think that was the last time there was some statistical information, women were still under earning. I think women were earning nurses were earning like $7,300 less a year. And then when you got into advanced practice, female APRNs were earning about $16,000 less than men. So I don't fully understand why that gap still exists. I feel like respect-wise, we're gaining ground, we're improving, but the economical aspect is still there and pretty glaring.
Yeah, that's something that still needs to be addressed for sure. Nicole, how about you? What are some of the challenges that you've seen in your experience for women in the healthcare field?
Sure. So I think for me, I'm looking at it more from a leadership perspective. And historically, healthcare has been a very male-driven profession. And I'm not speaking obviously just to nursing, but medical providers in general, and very hierarchical as well. And women tend to take leadership roles that in healthcare that are really service driven. So nursing leadership, things of that nature. So very few CEOs, COOs, CFOs in healthcare are occupied by females. And I am fortunate that in my organization, our whole executive team is all women, which is pretty incredible. That actually transitioned about a year ago. It's been very interesting. But in a very heavily male dominant profession, I think women in a leadership position like that really have to have a very strong voice and be very strong advocate for themselves. And I think that's the challenge. And I think that's why a lot of women don't get to that level, because if you practice in a very strong and confident manner, it can be viewed as you are not likable because you maybe aren't as nice as you should be as a woman, right? And you also have that balance of wanting to be a mom maybe, or a wife, and then balancing that with a career. That's a distraction, honestly, and not necessarily in a bad way, but it's a distraction from that path of becoming a leader, because you get pulled away to have a child, or you get pulled away to get married, and you get pulled away because your kids need you drive them to hockey 7 days a week, which is my life right now. So that is where I see the challenge in the leadership role. And I think that there's a lot of opportunity in healthcare for women to really change the direction that our healthcare system is going.
Thank you. That was really insightful. Carrie, how about you? Challenges that you've seen women face within this healthcare industry?
Yeah, uniquely, I have like two different disciplinary perspectives from athletics, especially with male teams or organizations. There seemed to be this sense that like the female athletic trainer just like blended into the wall and wasn't there until they needed you. and then they really wanted you there. But other than that, you just like sort of maybe became part of the crew, part of the boys. And so, I recall frequently, particularly when I was a graduate assistant and in my time at Castleton as well, reminding the male student athletes that like, I'm functioning in a professional capacity right now, so that's not appropriate, language. Or we are in a workplace, that behavior is not condoned here. So please improve your manners and trying to do so in a kind way. And also, carry some of the like authority that the professionalism and the credentials and the work that you're doing should command without, being too harsh and then like not being nice or friendly or any of those other things that women are supposed to be all of the time. And I think some of that has gotten better from some of my classmates and colleagues who are still in the athletic training field. And also of note, I uniquely was younger and closer to the peer age of those student athletes. And so that it may have been harder to draw that firm line from their perspective, because I was relatively close to them in age. But from the nutrition and dietetic side, I think it is uniquely primarily female-dominated healthcare profession. And so there can be a level of competitiveness, as Adrienne mentioned, within the discipline. But I've also found there to be a lot of support from other female colleagues in lifting one another up. And I'm not sure exactly what about nutrition and dietetics makes that a little bit different from what Adrienne's experiences have been. But I do find that from my work in clinical nutrition, that the recommendations and advice of dietetics to other healthcare providers is not always followed through and respected. And they may ask for advice or nutrition recommendations for a patient who's intubated and needs a tube feeding, and a very specific calculated tube feeding, for example. And so the dietitian provides those recommendations, and then the advanced practice provider does something different. And again, I'm not sure why that is. So I think, as the other panelists mentioned, like continuing to advocate for ourselves and to work together to lift women up is what's helping see the change in the tide that both of the others mentioned.
Thank you. Thank you.
Carrie, I can promise you as a provider that I follow your word to the T.
Thank you. And that's going to be good to hear, Carrie.
Yes, very much so. Thank you, Adrienne. I I appreciate that. I did have a very lovely resident, a male resident, where a neuro patient was on a medication and they were maybe going to taper it, but maybe not. And I was like, I'll do you the favor and write 2 recommendations. One, if you keep them on this medication for their tube feeding, and one if you don't. It was one of the last days of my dietetic internship at Maine Medical Center. And I will always remember that day and saying, I actually put in 2 recommendations for you, depending on, which direction the patient care goes. And he was appreciative. And then I followed up on that patient the next day, and they were on the recommendations that I sent.
That's great. For many of us, the pandemic saw a pause either in our jobs or we were working from home. But for healthcare workers, you've found yourself on the front lines of this pandemic, working harder and longer than you had previously. How has your work, Adrienne, been impacted by the COVID-19 pandemic?
I actually think it would be probably an easier answer if I told you what wasn't. It really, every aspect has been impacted in some fashion. How we communicate with our patients, we have patients out of fear that have avoided or delayed care to their detriment, and then trying to play catch up, months and months and a year later, trying to traverse the thousands of emails that would come in with changing recommendations, sometimes daily. In fact, I remember when COVID first hit, we were getting, the updates of like what the PPE recommendations were going to be, or what was going to be expected, or how we were going to see patients. And sometimes they would change within the same shift, and it was exhausting. It was absolutely exhausting. I will say that the majority of my colleagues and I can only speak with the people that I work for and with, just showed tremendous grace under pressure. Like you wouldn't really have known that, everything that as we knew it stopped. They may have behind closed doors or when they went home, had a completely different dynamic, but at work, people just, they showed up. They showed up and they did their job and they did it tremendously. I am grateful, beyond grateful that things are starting to return to normal. I miss being able to see people's faces. So much is lost when half of your face is not, translatable. I think my ability to communicate with patients is returning to normal. But yeah, I can't think of anything that wasn't impacted in some fashion.
Yeah, hopefully we'll continue to make progress for sure. Nicole, how about you? How were you impacted in your position by COVID-19?
Well, yeah, obviously similar to Adrienne, everything was impacted by COVID. Interestingly, when COVID first hit, we expected our census to drop. We didn't. That was our projection, and we actually saw the exact opposite of that. Our census exploded. Because people didn't want to go to the hospital. They didn't want to go to the doctor's offices. So providers were relying on us to go to patients' homes and provide the services and really make sure that they were staying out of the hospital, because the providers didn't want to send them there either, because that was the worst place to be. And we added actually quite a bit of services during the height of the pandemic to, again, keep people out of the hospital. We added additional IV infusions that we were doing at home, phlebotomy services that we weren't doing for community patients, things of that nature. But I think mostly for us, it really forced us to embrace technology in a way that home health and hospice never really did. Performing visits via telehealth. That was not something that we ever did. Using telemonitoring to supplement visits because staffing was always a crunch. So, trying to maximize the staff that we had and managing that patient volume at the same time was very, very challenging for us. But I think that was the biggest change. I mean, technology was always there. but it, like I said, it forced us to embrace it. And actually it's been a huge advantage for us, and we'll continue to do it for probably forever.
Yeah, this being able to Zoom is that silver lining and connect with people that previously we weren't able to for any number of reasons. Carrie, how about for you? What was the biggest impact felt by you during COVID-19 in your position?
Yeah, at the time I was working as an outpatient dietitian with the Edge Sports and Fitness. And so I remember at 3 p.m. they were like, you're going to go home and you're going to work from home tomorrow. Pack up your office and don't plan to come back for like 2 weeks or something like that. And whatever the governor of Vermont said. And then that, as we all know, that continued for many, many months. And so like Nicole, it was transitioning to technology. And fortunately, both the organization I was with at the time and the state of Vermont at the time had already begun transitioning to teleWIC or telehealth appointments for WIC participants as well. So both organizations really just shifted focus to use technology and then work on creating efficiencies to facilitate client services and client care with the remote technologies that we have access to. Follow-up email templates to quickly share handouts and resources. Some of the referral processes and things of that nature for the WIC program were already in place. But the biggest transition was technology and telemedicine. And I agreed. I don't think it's going away anytime soon. It's so convenient. I've experienced, the flexibility of it in my own personal life. And I know that the state of Vermont and the WIC program are actually doing some research into video conferencing for appointments for families, and also plan to keep teleWIC an option for some appointment types. There are some appointment types that in the absence of the federal waivers I mentioned previously would necessitate an in-person appointment for those evaluations and screenings, but there are some that we can make optionally teleWIC for the convenience factor and accessibility of maintaining their appointment schedule with different clients. Yeah.
Thank you. Adrian, what motivates you to grow and advance in your career?
I guess in all honesty, I like success. I take a lot of pride in what I do, especially when I've done something very, very well, or I've fixed a problem. That's something I get a tremendous amount of, satisfaction and fulfillment out of it. I think pretty much anybody in the science world likes to fix problems. Regardless if it's, a dietary issue or, a systems issue, or, I think we like to, fix the problem, improve the situation. So I think that's probably what motivates me the most is I enjoy the success of it.
Thank you. Nicole, how about you? What do you find that motivates you to advance and grow in your career?
For me, it is empowering my staff and watching them grow and be successful, and watching them achieve their goals is rewarding for me, and helping motivate them to be better and motivate them to do better. And ultimately, obviously, the high quality patient care is the mission and the goal ultimately, but you can't do that without the staff and having somebody behind them. And so I think for me, it's watching them, like the aha moments that they have, the light bulb turns on, and they get it, and it's like, yes, that's so rewarding for me, because it ultimately trickles down and affects the patients in their homes. So
thank you. Carrie, how about you? What motivates you to continue to grow in your career?
Yeah, I think serving my clients to the best of my ability with the skills and tools or resources at my disposal is what helps fill my cup. Whether it's a client that, has a breakthrough in regards to, some nutritional need or mindful eating during pregnancy or something of that nature that is going to lead to positive health outcomes, or, some of the families I'm working with currently, navigating picky eating to build lifelong healthy eating habits for their, toddler, right? If we can build some of those strong habits, positive habits now, like how much healthier is our state and our community and our country and our world going to be? I mean, I could just go on and on. And so seeing those breakthroughs, seeing those changes in patterns and behaviors that I know are going to lead to an improvement in their health when they see their primary care provider or long-term positive outcomes fills my cup.
That's wonderful. Let's switch gears for a minute and ask more of a whimsical question. How about Adrienne? What's one of your favorite Castleton related memories?
Well, I wasn't a traditional student, so I had a child when I was in college. I was a commuter, so I didn't have a lot of the the traditional memories. I think for me, my memories or the core memories I developed were associated with accomplishments, like when I nailed an exam, because our grades were based on 4 exams, and that was it. Like if you didn't pass one exam, it could be tremendously detrimental to you, those sorts of things. But I think I would say 2. My first one is the very last day of clinical. I remember driving up to the nursing building, and it was a gorgeous, sunny spring day. And I think it just dawned on me, I did it. Oh my God, I did it. It's done. I succeeded. So wow, it's over. Thank God. And just that, oh God, that sense of accomplishment was just profound. And then my pinning ceremony. I still actually remember the dot on my daughter's dress, and she had these cute little white shoes on. And I remember looking out and, hi, mommy. And I'm gonna get teary. I remember knowing we were gonna be okay. Sorry.
Oh no, that is got me tearing up too. Absolutely.
Yeah, that's my favorite.
And it was even more sweet when you got to pin your daughter as well.
Yeah. Oh my gosh, that was so amazing.
But thank you. Nicole, how about you? What's a favorite Castleton memory for you?
I have many, but the pinning ceremony is definitely one that is my most favorite. I just remember sitting in the row, right, up at the stage and listening to my professors speak, and I had a note from one of my professors who was actually my counselor, and she, in the note she spoke about becoming a colleague of hers, and I was like, wow, okay, I am no longer a student. Like these amazing instructors, these amazing professors who have supported me and guided me for the last 2 years and pushed me are now my colleagues, and I can actually maybe even like be friends with them. Wow. Like it was so amazing to be joining a profession that had such a close bond, and it was so exciting. That sense of achievement, as Adrienne said, that was obviously part of it as well, but just becoming one of them was just so amazing, such an amazing feeling.
Thank you. Carrie, how about you? A favorite Castleton memory?
Yeah, one that sticks out in my mind is talking with my husband, the man who is now my husband, who was just this boy that I had a crush on at the time. He lived in Morrill and I lived in Wheeler, so our buildings were very close. And we had mutual friends and things. And I remember the warm spring sunny day where he was getting ready to get on the bus for a baseball trip, and picking on him for the cowlick that was in his little like faux hawk, because he would like shave a faux hawk for baseball season. But the breeze and the sun and this cute boy, and so that's one that sticks out in my mind.
That's a very nice memory. The time is sailing by. We're getting close to the end of our hour. If anyone has any questions, please put them up in the chat. I know that, Adrian, you mentioned the term, we eat our young, which is something that I just heard for the first time in relation to nursing. Can you expound a little bit about that?
I can describe it. I can't necessarily give you the rationale behind it because I never fully understood it. It is, when the brand new nurse comes into her unit, you're usually connected with someone who's supposed to be your mentor or your preceptor. If you're lucky, you have someone that is willing to actually truly teach you and show you the way it's supposed to happen, and be patient with you. What would happen a lot of times is you would have someone, and maybe it was burnout and we just didn't recognize it, but you would have someone that was very impatient, was kind of intolerant of your novice. And it would undermine your confidence, and everybody knows, like, when you don't feel confident, then you start to make more mistakes, and it would just become this like snowball effect. And I mean, people would leave, young nurses would leave units, they would leave jobs, and the profession, because it was just so terrible to experience. I managed to develop, I used to call it yielding to the big dogs. When I would go into, like, when I first went to the ICU, like, ICU nurses are, they're tough. They have to be to some degree. I mean, it's incredibly intense work, but I would just roll over and show my underbelly. Like, I pose absolutely no threat to you. Please be nice to me. And it worked. But yeah, I really don't know why our profession does it, as we're supposed to be caring and nurturing and everything that women are, and to each other, we are not. So hope that helped.
No, it did. And maybe it is burnout, and it's something I hope that new nurses are warned about in some regard. But just in closing, if each of you could, just a piece of advice for someone who wants to go into your profession.
Sorry, Carrie, real quick, I'm going to jump in. There is one question in the chat. So it's, did everyone wear white coats for pinning?
Did. Well, yeah, no, I didn't wear a white coat. I wore the white dress. Sorry. My daughter wore a white coat.
Yep, I wore a white dress as well.
Nice, thank you.
Do they still do the caps at all?
Do you know, Alicia? Because I still haven't seen a normal pinning or graduation yet.
I don't think they do. I think they just wear the coats.
Hopefully I'll make it to pinning and I'll let you know what happens this year, Adrian. So just real quick, one piece of advice that you would give someone going into your line of the profession, Adrian?
I actually think I would say be an advocate, not just for your patients, but for yourself. We are working in just unprecedented times. We have the pandemic, we have historic shortages. My goodness, we just had a court case where an unintentional med error became a crime. So being an advocate for yourself as you are going about your day, your career, everything, just, and it doesn't mean you can't advocate for your patients at the same time, but advocate for yourself, protect yourself.
Thank you, Adrian. Nicole?
I think being intentional with your words. I think oftentimes, you know, we're quick to open our mouths, and sometimes it's really beneficial to step back and really think about what you want to say and how you want to say it and how you want to be received. So really taking all of that into consideration and doing it with good intentions.
Thank you. Carrie, how about you? Some advice?
Yeah, along some of the similar lines, I would say communicate and collaborate, because so often in healthcare, we're working on an interdisciplinary team. And if we're not truly communicating and collaborating with the other disciplines, are we really caring for those that we're supposed to be serving to the best of our ability?
Thank you. Thank you. Once again, we're so thankful to each of our panelists that you gave us your time and shared your experience and stories with the community present here today. You know, you guys are doing the hard work and utilizing your degree you earned here to its highest potential. So we thank you so much. And I will thank everyone who joined us here tonight. We will be putting up the recording of this program for, it'll probably appear in the news and events section on the website. If anyone wants a link, please feel free to email me at the alumni office at carrie.savage@castleton.edu. And I hope everyone has a wonderful evening, and thank you again. Good night.
Thank you.
Thank you.
Thank you.